Discuss the another remedy from Phatak Materia Medica. That remedy is Abies Nigra. So this is the third episode of Phatak Materia Medica series. So we will start remedy. So this is Phatak tells about the Abies Nigra is first foremost is the gastric remedy. Main action on gastric organ, but not bland one. It is deeply connected with postprandial distress that relates beyond the stomach into heart, chest symptoms. It means that this remedy is main action on stomach, and this action is after eating postprandial and postprandial distress, and that goes to heart, chest symptoms, and many other symptoms. This is not just a simple indigestion. Clinically, it's a sensation of lump stuck in the cardiac end of the stomach. Very striking and persistent symptom. It means that the patient tells us that he is suffering from or he has complaints of uh, distress after eating in cardiac end of stomach. After eating, the symptoms gets aggravated, and especially in the stomach region or epigastric region. So it's a gastric cardiorespiratory functional dyspeptic remedy. It means that the gastric symptoms comes first, then cardio or respiratory symptoms due to dyspepsia, often in older peoples. Mainly it's old patients remedy. Sedentary habit, stress affected patients, especially where tea, tobacco, late and heavy food habits are involved. It means that type A personality or people who eat late, have heavy foods, have habits like tobacco, tea. In this majorly symptoms that describes that after eating heaviness in the region of epigastric region is due to mainly the dyspepsia, often related with maybe pancreatic insufficiency, or in this patient you may see the increased level of amylase lipase or slightly increased level of amylase lipase, or in these patients you may see the sonography chronic pancreatitis or high levels of lipids, especially triglycerides, that leads to chronic low grade pancreatitis that leads to these type of symptoms. But it is not uh, high, in more intensified symptoms of pancreatitis. It is chronic low grade symptoms, persistent symptoms. It may be due to the pancreatic juices secretion problem. So these are the main clinico-pathological interpretation of what Phatak says in 2 to 3 lines. So, what is the core of this remedy? Stuckiness in indigestion, in breath, and in vitality. The symptoms of stuckiness is the main core word, or one word we can say that for Abies nigra. These patients feels weighted down, stuck after small meals, and discomfort isn't just in stomach pain, it's a deep constriction band around the upper abdomen, rising sometimes towards the throat and chest. This remedy of postprandial blockage and heaviness is not just acidity. It means that it may be due to gastritis or gastric ulcer, may be behind the pathology, but main core that heaviness after eating is the more important. It is not only what they eat, it is the what they can't get down that defines the case. Maybe functional dyspepsia, cardiorespiratory reflex symptoms, but homeopathic language, this maps beautifully of Abies nigra picture. Maybe GERDs, maybe diagnosis after gastroscopy, The symptom totality and diagnosis we have to differentiate, means that every patient of GERD or pancreatitis is different. We have to identify the which is the same patients of GERD GERD is Lycopodium, Noxomica, Abies scan, or Iris versicularis or Condirango. In that way, the diagnosis is same, but remedies are different. Mentally, Phatak beautifully describes it as a very low spirited, unable to think or study. In this, patient may in our clinic says that, doctor, I can't concentrate anymore. The minute I eat, I feel heavy, my mind slows down, I feel dull, and just I give up. This isn't anxiety, it is not irritability, it is a mental sluggishness tied to the gastric distress. This is not a psychological depression as per se, it's more of a physiological fatigue with bleak mood, often exacerbated after meals and late night. Low spirits here means that faded energy, lack of cognitive sharpness, especially in daytime, and worsen after eating. So here, after eating, heaviness or low mood or low energy is the symptom that reminds us that remedy Faltawri. Faltawri has a sluggishness or sleepiness after eating. A remedy beautifully described in Phatak or in Boric Materia Medica, sleepiness after eating. The remedy of gallstone and remedy of sluggish gallbladder liver function. The sleepiness after eating is Faltawri, and sluggishness, these are two different, so differentiating points for these two remedies. Then there is no appetite in morning but hungry in noon and night. This is striking diurnal appetite polarity that helps to the distinguish in the case. It means that in morning the patient doesn't have much more appetite or hunger, but afternoon and night he has hunger. In sleep they are dull and tired during a day, yet restless and wakeful at the night, especially they haven't eaten late heavily. Low energy, uh, low energy, heavy, slow, and inherited, not the restless, agitated kind of. Modalities we can see that worse after eating is the keynote, top keynote of this patient. Worse lying down, cannot get comfortable after meals. Sometimes worse cold, better warmth and gentle motion. Peculiar symptom as early as I told, the signature of this remedy is sensation as if a hard boiled egg or a stone is logged at the top of the stomach or the cardiac end of the stomach. Patient might say in different language, it feels like something is solid or hardness in sitting is there or something is stuck in there. I want to cough up, it wake up, try to get down, but it is not indigestion. This is different kind. Breathing in chest, breathing difficulty, especially after lying down, sensation of lodging or compression in the chest. This remedy burns the line between stomach discomfort and respiratory sensation, so it pays attention. Heart symptoms: heavy, slow action, sometimes tachycardia or bradycardia associated with food and distress. These are functional heart symptoms without structural disease, exactly what homeopathy thrives on recognizing. So, as says in diagnostic point of view, or modern patient comes after seeing the modern medicine or gastroenterologist, they diagnose as a GERD, functional dyspepsia, postprandial distress syndrome, or with vagal reflexes, gastroesophageal reflux with non-erosive symptoms, or cardiorespiratory complaints that triggers post meal. These are the diagnostic made by the modern people, and we have to differentiate much more remedies with that. So main remedies we have to differentiate is Abies nigra with Noxomica. In mind symptom, Nux is more irritable and reactive. Abies nigra is low spirited and dull. In stomach symptoms, Nux picks up sour food and in crampy. Abyss has heavy and lump discomfort worse by lying down. Then another remedy is Nux vomica is morely due to lifestyle and habits, mostly tobacco, late night partying, stress, anxiety more, and these peoples are more of high spirited. In Bryonia, differentiating point with Bryonia and Abies nigra, Bryonia wants silence and Bryonia is irritable. Means he want to peace, lie down, and uh, aggravation by motion or aggravation by sound, and he is irritable. Abies nigra is mentally slow. In stomach symptoms, Bryonia pain in aggravated by motion, Abies especially after eating. The patient must stand and walk gently to ease. So rest is the better for Bryonia, and gentle walk or standing is the better for Abies nigra. The prescribing totality that we say in the Abies nigra, for the 4 or 5 lines we can say that patient complaints of heaviness and fight sensation after eating. After eating, complaints aggravate, especially after stomach or epigastric region. Hard stuck ache sensation at the top of the stomach, loss of appetite in morning, hunger after in afternoon and night, poor sleep after meals with restlessness, chest tightness or breathing difficulty after meals. These 4 or 5 things clearly indicates Abies nigra totality. When stomach distress sticks to the heart and breath, think of Abies nigra. Common mistakes while we do the prescribing Abies nigra is simply for general dyspepsia or heartburn without cardiac lump sensation after food, you may fail. It's a stomach remedy. Many people directly prescribe or directly prescribe Abies nigra for dyspepsia or heartburn. But when there is no heaviness or stuck sensation or hard stone sensation, boiled sensation, then it won't work. Always, always ask for or while prescribing characteristic, peculiar, uncommon symptoms. Also check for tobacco and tea habits after or heavy workload. This may you may find this differentiating point. Then when we describe, we want to describe or highlight the remedy in 2 or 3 words. It's a stuck sensation, heaviness, and postprandial. These three are highlights of Abies nigra: stuck, heavy, and postprandial. Uh, in one line, how can we describe the Abies nigra is, if stomach feels like a hard boiled egg, just sat there and won't go down, the Abies nigra is your choice. So, this is the Abies nigra in short term, how Phatak describes. So, hope you will like this session. Thanks for joining.